This rise in transmission, as well as this new variant of COVID, should be a warning to us all that even after such a difficult year, we must stay vigilant. People of all ages can spread this disease. Around 1 in 3 people don't display any symptoms at all, but can still spread it. And we should never lose sight of each of our own roles in this, our personal responsibility, each and every one of us, to respect the rules where you are. Don't ease up on the simple things that keep us safe, like hands, face, and space, the social distancing that we need, and to come forward and get a test. This moment is a salutary warning for the whole country. This isn't over yet. Please play your part and do all you can to stop the spread of this disease. And I'll now turn to Professor Whitty to go through the data and the details.
Thank you, Secretary of State. I just wanted to show 2 slides here. The first is the case rates, the number of new cases in London and the parts of Essex, Kent and Hertfordshire that the Secretary of State was talking about. And what we have here is the number of cases over the last several weeks. There was a gradual drifting up before the lockdown period, not as fast as in parts of the north, east, northwest and east and west Midlands previously. But in those areas, many of which are now in Tier 3, the rates came down. In London, they came down more gradually, and the surrounding areas. In parts of Kent, they continued to rise. And what you can see here is over the last few days, the rate of increase has started to accelerate very substantially. And as the Secretary of State said, there are some areas now which are increasing at a rate of 7 days or even fewer than that. And that means if you just think about from now till Christmas, that is just under 2 doubling times for many areas. So these rates could go up really very rapidly. Next slide, please. This is on a background of there having been a drifting up of the number of cases of people in hospital with COVID in London and the surrounding areas. Again, the Secretary of State has laid out already. So this uptick, which is not yet fed through into hospitals, but will start to over the next week to 10 days, is on the background of already rising rates that already are putting some pressure on some hospitals and considerable pressure on others. And this will lead inexorably not only to COVID deaths directly, but it also leads importantly to displacing other health activity. That means that other diseases are not being treated if we do not get on top of this quickly. So it is very important that we take rapid action to try and pull this back down again. And I think the final point I'd like to make is just to think what was achieved in the north of the country and in the Midlands when people really did decide to pull things down in an equivalent of the Tier 3 at the moment, and communities came together to try and achieve that, and the rates came down. Look at what happened, for example, in Liverpool. Look at what's happened in Manchester and parts of the northeast. So it is possible to turn this around with the tools we have, but unfortunately that does mean having to move into Tier 3, as the Secretary of State has said.
Thank you very much, Professor Whitty. I'll now ask Professor Fenton to set out some of the actions that are being taken in London and the surrounding areas, and also critically this point about what we're asking people to do to help get this under control.
Absolutely. Thank you, Secretary of State. This is a pivotal moment for London and the southeast of England. As we've heard from the Chief Medical Officer, numbers and rates of infection are now increasing exponentially in parts of the southeast. And this means that quick and decisive action is needed. There is a strong connection between the increases that we're seeing in London with parts of the southeast of Essex, south of Essex, as well as the southeast region. And it really is important that we are working together, coordinating carefully across the regions to ensure that we act to control the infection now. Specifically in London, we have seen increases in rates, especially in the northeast of the city, connected to South Essex, as well as in the southeast, connected to Kent. But more recently, we are seeing exponential rises in a number of boroughs across the city. And this is of concern because we know that as we see general increases in rates, it will follow that we will see increasing rates in those aged 60 and over who are at high risk of being hospitalized and dying from this infection. Over the past week, we have been escalating our efforts in London, increasing testing availability, strengthening campaign messages, working with community organisations to really engage the hearts and minds of all Londoners and people living across the South East to both take this escalation seriously and to act, putting in place the things that we all know we need to do. Keeping our hands clean and avoid touching our face, ensuring that we are wearing face coverings, especially in crowded or enclosed spaces, especially during the busy holiday period, and ensuring that we're socially distanced as well, especially outside. And most importantly, because of the increasing rates of disease, getting tested and isolating if positive remains critical. Now, over the coming days, you will see more about coronavirus across the city as we increase campaigns and messages to all of us as Londoners, to all of us living in the South East, to take heed, to follow the rules and to follow the guidance for Tier 3 and to prepare for the holiday season ahead. Thank you, Secretary.
Thank you very much indeed. The first question is from Ryan Hancock, who comes to us from by video.
Hi, thank you for letting me ask my question tonight. So my question is, with the current infection rate and death rate on the increase, after the mixing of households over the Christmas period, will we see a fire break in January? And also, I work in A&E as a nurse, and we're seeing an increased demand in the A&E department with the coronavirus pandemic. Is there any plans on tackling this?
Well, thank you, Ryan. I should say Ryan from Cannock. I appreciate your questions and thank you very much for the work that you do in A&E as a nurse. We really appreciate it and thank you to all your colleagues. We are seeing increased pressures as you described, and we're seeing that across many parts of the country, especially London and the South East, but also some other parts of the country too. I'd say two things. The first is, it is incredibly important that people are careful and cautious, especially ahead of Christmas, and especially if they want to see loved ones at Christmas, and that we are very vigilant about our own responsibility, as well as, of course, abiding by the rules. The second thing is, in terms of the increased pressure that you mentioned on our hospitals, that's why we're taking the action that we are today in London and its surrounding areas, and then on Wednesday we'll look as planned across the whole country to see which areas need to be in which tiers so that we can try to keep this virus under control and suppressed until the vaccine can be rolled out to enough vulnerable people that we protect life. I'll ask the Chief Medical Officer also to answer especially your question about Christmas.
Thank you, Secretary of State. I mean, the first thing to say is extraordinary tribute to everybody, all my colleagues in the NHS, in particular in A&E, who are absolutely at the front line of all of this. And I think what everybody in A&Es are saying and writing is this is going up in very many parts of the country, not absolutely everywhere, but very many parts, particularly now in the southern parts of the country. And we absolutely must get on top of this, because if we do not, the period after Christmas, the most difficult period for the NHS, which is January and February in every year, is going to be extremely difficult for every area of A&E, of general practice and the rest of the health system, and that's going to have a big impact. In terms of the impact of Christmas, the thing which we have repeatedly said to everybody, and I think it is in a sense common sense to everybody, is that the fact that some relaxations have been made not to the tiering, but to people's ability to meet their families over Christmas does not mean that they should go to the top of the license of that. They should do everything that is possible. The point of this is for, under certain circumstances, families who wish to get together. But they really have to be very, very careful, and in particular, incredibly careful if they're around people who are vulnerable, who are at very high risk of this virus. In the medium term, the vaccine is going to give us a way out, but it is not going to give us a way out between now and Christmas, or indeed for the 2 months following that. And we need to be really conscious of the fact that only by protecting one another, and particularly protecting the vulnerable over this period, are we going to get through to the point where people have been properly protected and we can return to having the kinds of relationships with family that all of us want.
Thank you very much indeed. The next question is from Becky from Gateshead, who comes to us by text. As a young couple hoping to start a family, how can we be assured that any COVID-19 vaccine will not affect our fertility if the long-term side effects have not been researched? Well, thank you, Becky. There's no better person to answer this question than Professor Whitty.
Thank you. So there is no current evidence of any impact on fertility, and I think it is important that people are aware of the fact that obviously lots of concerns are there, and people who are wanting to start families, of course, have concerns very reasonably about any kind of drug or vaccine. But there is no evidence currently of any of the vaccines having any impact on fertility, and it would be quite surprising if any of them did do. This is always something which is raised in new vaccines, and this is not something which has been seen as a major problem for vaccines. So this is not an area where I think people should be being concerned at this point in time. Second point to make, of course, is that the first several tiers of this which have been laid out are people in their 80s, in their 70s, healthcare workers with significant health problems, then people in their 60s and 50s. And for them, this is absolutely obviously not something for most of them they're going to be thinking about. What we need people to remember is that there is a very substantial risk from this virus, particularly in these groups. What we have is one vaccine that has already been given authorization for emergency use, and 2 others that are under consideration at the moment for emergency use at different stages of the process. And we must get these vaccines out to those who are the most at risk, because if we don't do that, this situation where older and more vulnerable people can get sick, can end up in hospital, and in some cases sadly die, is going to be a continual process. So we really must concentrate on trying to achieve that.
When the NHS calls, having the vaccine is the best way to protect yourself, to protect those around you, and to protect your community. So I hope when they call, you take up the offer. Thank you very much indeed, Becky. The next question is from Hugh Pym from the BBC. Hugh. It's from Vicky Young.
It is. Hugh's not with us at the moment. Can I ask you, first of all, given the rapid rise in cases we're seeing in some areas of the country, should you be rethinking plans to relax the rules over Christmas? And a question to Professor Whitty as well. Are you comfortable with the plans for Christmas? And secondly, news today of a new variant of coronavirus will sound very alarming to lots of people watching at the moment. Could you tell us a little bit more about it and some of the possible repercussions there might be from it?
Thanks very much, Vicky. As I said in the response to Ryan, I think it's important that all of us are cautious ahead of Christmas and very careful in terms of the contact that we have, especially with people who we know are vulnerable to this disease, which of course includes older people and those who have clinical conditions that make them vulnerable. So it is our personal responsibility to make sure that we follow that. But at the same time, we do understand, especially after such a difficult year, why people want to get together with their families and their loved ones over Christmas. Chris?
I'll make a brief comment on Christmas. Professor Fenton might also want to add to that, and then I'll just talk about the new variant, since that's new information today. On Christmas, I think all of us know, and there's no secret about this, that Christmas is a period of greater risk, and the festive season more generally is a period of greater risk. But at the same time, what we've tried to do, all of us as society, is trying to find this really difficult balance between doing things that are the least damaging we can achieve whilst keeping the virus under control, walking that really narrow path, There was a strong sense, I think, from many people that allowing those who wanted to get together at Christmas, provided they understood the risks involved in that, and provided we really take this seriously before Christmas, reduce the risk as much as possible going into it, during the Christmas festive season, and then afterwards, this is something which, in a sense, tries to strike that balance. But of course, it's a period at risk, and that's the reason we want people to take it very seriously and go no further than they have to. In terms of the new variant, the reason this has been picked up is because there is a good surveillance system in the UK, wider than in many other countries, and it does appear to be in an area of the country, particularly Kent and bits of London, which are increasing rapidly. Now, we don't know what's cause and effect. Is it getting more frequent because it's in a part of the country which the rate of increase is going faster anyway, and therefore inevitably it's a higher proportion? Or is it that this virus itself is possible to transmit more easily? That isn't really yet clear. There are two other things you always want to worry about with a new variant. The first one is three things, actually. The first one is there any evidence this is actually more dangerous? And there's no evidence for that at the moment. There's no evidence that if you catch this variant, you're more likely to have severe disease than if you catch different variants. The second question is it invisible to the tests we have? And the short answer is no. The current tests work against this variant. They might have, some of them might have one bit of the testing might be slightly less effective, but most of the tests will work completely normally. The other ones will work, we think, normally as well. And the third question, given that we now have a vaccine around the corner, is would we expect this to reduce the effectiveness of a vaccine? And I think the thing to remember with this is we don't yet have a vaccine deployed, and there's relatively little, still quite a small proportion of the population currently have immunity due to prior infection. So there isn't huge selection pressure on this virus, and therefore it would be surprising, not impossible, but pretty surprising if this would actually have evolved to be able to get around the virus. As time goes by with any infection, then there's selection pressure, what's called selection pressure, when a very high proportion of the population has been vaccinated. And at that point, the new variants that emerge, and new ones will emerge the whole time, are more likely to be ones which actually are able partially to escape from a vaccine. But there's no reason to think that would be happening at the moment. But that's being tested at the moment in Porton Down and other specialist centres, and we'll be able to give more hard data on that relatively soon, and we will obviously do so once we have it.
Thanks very much.
Does Kevin want to answer on Christmas?
If we turn to Professor Fenton.
Thank you, Simo. I wanted to reinforce that we're now exactly 2 weeks away from the Christmas holiday period. So the actions that we take now are going to have a huge impact on our risk of acquiring the coronavirus before the holidays and our ability to have a much safer Christmas period. So taking care now, both of our families and ourselves, the actions that we take will be important. The Christmas period is not a time to relax the rules. The restrictions in the tiers will still be in place. But the Christmas period allows us to meet those who are nearest and dearest to us, but also taking the care to prevent transmission to them as well. So using these next 2 weeks will be critical for Londoners and for those across the South East to reduce our risk of acquiring the infection and, of course, passing it on to others.
Thank you very much indeed. Thanks, Vicky. The next question is from Sam Coates at Sky. Sam.
You are today begging everyone to minimise the number of people that they meet, and we've just been told that January and February are the most difficult periods for the NHS. Aren't you undermining your own warning messages by going ahead with the Christmas relaxation? Are there any circumstances in which you would rethink it? And Professor Whitty, do you find that the government can be resistant to putting areas in Tier 3 when you suggest, shouldn't this have happened in London a week or maybe even several weeks ago?
Thanks very much. Look, our message around Christmas is really clear, which is that we understand why people will want to see their loved ones, especially at this time of year, especially after this year. And we all feel that. But it also must be done in a way that is careful and responsible. And I think people understand that too. And that's why we've taken the approach that we have. But if you are planning to meet up with loved ones at Christmas, then being careful now, 2 weeks ahead, and making sure that you minimise the chance of both catching the disease and passing it on is the right thing to do. Actually, that's the right thing to do all of the time, because whatever the rules in your area, the more that you can restrict your social contact and your ability and likelihood of passing on the disease, the more that you'll help us all to get through this together, and to get through this and keep the rates down until the vaccine can protect enough of the vulnerable to save life. So that's the approach on Christmas. And I'll ask the CMO to answer the second question.
Well, I mean, it's obviously never going to be a perfect time to go into any tier. The reality is that doing so reduces the transmission of the virus, but that does require everyone to buy into that. At the same time, it does a lot of social and economic damage, and that is really clear. And so trying to balance those two is what the government centrally, also local leaders, it's important to understand these are very much decisions that are discussed between central government and local leaders. They also have to make these really tough decisions which have harms on both sides. Go too late and too light and the virus takes off, go too early and you damage large numbers of social and economic activities without huge benefits. So trying to get that right is very hard, and the idea of perfection when you're choosing between two bad situations, I think should be avoided. It's not, there isn't a perfect time. What everybody is trying to do, whether it's local government, local directors of public health who've been outstanding throughout this, and central government, is to try and get a balance which is reasonable between these two very difficult directions.
I just add one more thing before asking Professor Fenton to comment, particularly on the London point, which is that because we've increased the turnaround times of testing, we now get the results in faster. And so we've been able to take this action today based on the sharp increase in the case numbers that you saw in Professor Whitty's slide that started 6 days ago. So being able to go from spotting it to taking the action in a very short period of time, from cases that were only tested 6 days ago, and then to be able over the weekend to have the discussions and take the action this morning. Professor Fenton.
I think one of the other reflections is that Londoners have been fantastic in responding to the pandemic, from emerging from the first wave to keeping rates of infection low throughout the summer period. And then over the autumn, we've been having gradual and sustained increases in rates. But at each time, we've moved deliberately and early to the appropriate tier to help to keep infections at bay. The fact that we now have early signals of an exponential increase in infections means that now, once again, we're asking Londoners to pull together to help us to get ahead of the curve, to help us to ensure that as we move into the holiday period, that we have all the tools and the power that we need within the tier to help to control the rate of spread of infection. So it is difficult because at any given time, we're managing individual health, the health of the public, as well as the economy. And those discussions are never easy. But what's most important is that we're making the right decisions at the right time, which I believe we're doing now for London with Tier 3.
Thank you very much. The next question is from Ben Kentish from LBC. Ben.
Thank you, Secretary of State. One of the reasons the UK suffered so much in the first wave of this pandemic was because the virus was seeded across the country in so many separate incidents. Is there not a very real risk that that is going to happen again because of Christmas? And what does SAGE modelling tell us about the size of the rise of infections we should expect to result from that? And for Professor Whitty, particularly, if I could, London has been in Tier 2 for almost 2 weeks. Cases have soared. Kent has been in Tier 3 for almost 2 weeks. Cases have soared. Is it now time to accept that the current tiers possibly aren't enough to control this pandemic?
Thanks very much. On the modelling around Christmas, Ben, it all depends on people's behaviour. And the most important thing is that people are cautious and careful ahead of Christmas and during Christmas. And hence we're saying that so clearly. And I think it's certainly, from talking to people, the response I get, this is how most people are thinking about Christmas as a time, yes, to see loved ones who we may not have been able to see for a long time, but to do so really carefully. And so it isn't about doing the maximum that the rules allow. It's about taking personal responsibility. Chris.
On the tiers, I mean, they are, to go back to the previous question, an attempt to find a balance between things that maximally suppress the virus and things that do minimal damage to people's livelihoods and lives whilst achieving that. And there is not a perfect solution. In terms of the tiering, many parts of, particularly the north of the country and the Midlands, have come down and have stayed down using things which are very similar to tier 3. And from a high level, and several places have managed to hold the line with things that are very similar to tier 2. So the tiers in many areas are working. What we had in London was a situation where things have escalated, and this is now clearly a time to move over to tier 3. That's the reason for the decision today. My own view is that it would be very difficult to get on top of things in Kent and indeed parts of Essex and other parts of the southeast, whilst London rates are still continuing to rise, because there's so much traffic in and out of London from all around the east of England and the southeast of England. So I think it is very important for everywhere that London is going in to tier 3 today, as well as many other areas of Essex and Hertfordshire, in this decision. So the tiering is, it is not a perfect tool, because the idea of perfection is not possible. But what it is an ability to escalate up, and in due course, once the vaccines are properly beginning to roll out, once we're getting closer to spring, to be able to escalate down. This is obviously something which can go in both directions. So it's an ability to flex the system, but no one would like to be in the situation the world is, all of Europe is at the moment. What we're trying to do is balance two very difficult harms.
Thanks very much. Next question is from Chris Smythe at The Times. And we can't hear you, Chris. No. Let's go on to Kate Proctor at Politics Home and then try to come back to Chris Smythe after all of the questions, if we can. Kate, hi.
Thank you very much. I've got a question for Professor Chris Whitty on the variant that's been found. Could you tell us a bit more about exactly when this was discovered, what was the date, and also there was reference in the Commons earlier to it being found in other countries. Could you say which other countries it has been found in, and are the symptoms exactly the same between the different strains of coronavirus? And on Christmas, I just wanted to go back to this. I mean, is this really Christmas at any cost? Are there no circumstances, particularly in relation to cases rising, in which the government will look at the rules again? That's a question for Matt Hancock. And lastly, for a family in London, if they have a teenager who's at a school where there's been a high number of coronavirus cases, should that teenager then go and spend Christmas with their elderly relatives?
Thanks very much, Kate. Well, I mean, I've given the answer on Christmas to the same question several times now. We're really clear about the way that we think about it. Of course, people should be careful. For instance, teenagers going to stay with grandparents. We need to be really careful about that, and we need to take very seriously the high number of cases that we've seen. Which in London, especially in northeast London, started with a sharp increase in children of school age, but actually now has spread to all ages across the population. On the first question on the new variant, I'll hand over to Professor Whitty.
Yeah, I mean, the data's been brought together very recently. I mean, obviously some of it's relating to specimens that were taken much earlier, so there's an ability to track it over time, and that's one of the reasons that we can see that it has expanded over time, but that's looking backwards. But in terms of the data being pulled together, and there's been a lot of analysis done over the last few days and to try and work out what this means, and now to try and work out, for example, what does it mean in terms of vaccines and so on. So, I mean, this is a continual picture. And in terms of other countries involved, I mean, there are some countries that have had things that look quite similar to this, but maybe unrelated. And then there are others which may well have something similar. But again, they're now looking at this properly. This has been loaded up. There's an international database of all the variants. The UK is one of the biggest contributors of that, in fact, by some distance. And so other countries will now be looking at this, other nations, to see what they've actually, where it has spread to, if it has spread elsewhere, or indeed whether it's been spreading there even before the UK. We don't know that one way or the other. And in terms of the symptoms symptoms things, so far, there is no evidence that the symptoms are any worse or different from other variants of this coronavirus. And there are many variants. And I think it's not just there's one coronavirus and this is the variant. There are many variants. It just happens that this one has quite a few more mutations than some of the other variants. So that's the reason why we've taken it more, particularly seriously. But there's nothing to suggest that the symptoms are different, that the testing is different, or that the clinical outcome is different for this variant. The main reason we are raising it to people's attention is the question about, is this spreading more quickly? And that may be cause and effect, or it may not.
Thanks. I just want to add one thing at this point, because it's not an accident that in this country we have one of the biggest genomic testing services in the world, as well as the now vast PCR testing capabilities. It's because of a consistent investment in genomic research over 10 years or maybe longer in this country. And I want to pay tribute to the researchers, both at Genomics England and the very broad academic partnership, who brought this to our attention. It's because of this huge surveillance system for coronavirus that we've built up that they could see the problem in Kent and went specifically to look and to see if there was anything going on. And by sequencing these genomes with the capability that we've built up, we're able to come with this insight, which we're able to discuss. And it then it came to me on Friday night, and we worked over the weekend to understand the consequences and the action that we had to take. Now, the problem is that the epidemic was increasing in London and its surrounding areas anyway, and the actions that you need to take are the same. But nevertheless, it's a tribute to British science, and in particular, the support that's gone into genomics over the past decade that means that we're in a position to be able to identify this sort of strain and then act on it.
I think one thing which I've heard in the public debate is the reason why Tier 3 has been brought into so many areas because the variant has been found. And the answer is straightforwardly no. The reason that Tier 3 has been brought in is because the rates are going up very fast in many areas. The variant may or may not be contributing to that, but the reality of that is happening across the board, and that's the reason for making the changes.
Very good. Thank you. Next question is from Nick Cecil. If we've got Nick, great. And then after Nick, we'll try to go back to Chris Smythe. Nick.
Yes, first to the Secretary of State and to Professor Fenton. Given that lockdown appeared not to be working in London with cases rising even before it ended, why do you think Tier 3 will work now? And to Professor Whitty, is it wise to relax the restrictions to such an extent over the Christmas period? And what do you think the impact of that will be on the mortality numbers from COVID?
Thanks very much, Nick. The thing that I would say is that if across London and the surrounding areas where there are these sharp rises, if we all come together and follow the Tier 3 rules and respect the social distancing that's necessary and do our bit, then we will get this under control, get it down, and get back into Tier 2. And it is that community response which is necessary. Of course, the rules in the tiers are important, but we've learned, as Professor Whitty was saying earlier, we've learned from parts of the north of England that when everybody in the community basically decides to make it happen, you can get this under control and fast. And the first place we saw this really working was in Liverpool about 6 weeks ago, when we put in the extra testing. The local leadership were very clear and strong with the public messaging, and the rates came down, and everybody did their bit. And everybody is part of something that's bigger than themselves, which is, can we get this city out of the tier? And we saw the result of that because when we came out of national lockdown, Liverpool went into tier 2. And we've now seen the same pattern across several cities in the north. We've seen it in Manchester recently, and we've seen it in Newcastle, and we've seen it across the Tees Valley, where there's been very strong leadership, including from the Mayor, Ben Houchen. And we're starting to see it in some other parts of the country as well. I would single out Bristol, which has also had a very sharp rise, very sharp fall, and Nottingham. So we can do this, but we need to do it together. So yes, of course, it's about the rules, but it's also about how every single person behaves and how the brilliant local media make sure that they echo the important public health messages. We can do this if we do it together.
I entirely agree, Secretary of State. Let's be clear. The national restrictions did have a positive impact on many parts of the city. There were many boroughs that benefited with reducing rates during November moving into early December. And what we need to understand are the tools to that success and ensuring that we continue to work with communities to adopt the protective and preventive behaviors so that these tiers and the restrictions do actually work. The challenge that we have now is that the rates of infection across the city are relatively high, and so therefore we need additional restrictions to help us to control infections. And Tier 3 allows us to place restrictions on the hospitality sector, as well as limits mixing between households, two of the main drivers of transmission of infection in London. And as you've heard earlier, we've also been doing intensive work to help to identify infections in schools and to address transmission in schools as well. So the combination of these interventions, the combinations of these measures will help us to continue to control the rate of increase of infection. I hope that, as the Secretary of State has said, that this tier will only work if we all pull together. And Londoners have done this before, and we will do it again. So it is the actions and the decisions that we make today that will help to make that difference over the holiday period. But most importantly, keeping rates of infection down is going to be critical in protecting the NHS and ensuring that other critical services are able to function and be delivered over the holiday period. So again, we all have to pull together to make the tier work and to make these restrictions work.
On Christmas, I mean, there's a danger I'll sound a bit repetitive, but it is, all of this is about balancing the wider needs of society with the need to keep the virus under control. And the relatively modest, actually, relaxation over Christmas will undoubtedly put upward pressure on the virus. We know that. That's been clear from all the statements that everybody has made, all ministers and all the people who've commented from these press conferences. But the feeling was this is a very important time for many families, but, and the big but on this is, the level of impact this will have entirely is related to how many people choose to do this in a very minimalist, responsible way, and those who wish to choose to come together and do all sorts of things which they otherwise wouldn't be doing if it wasn't for Christmas, that's where the risks start. So people have just got to take this very seriously. This is an ability for families to come together within the law, within the rules, and people have been incredibly good at sticking to the rules and sticking to the guidance. And this is, in a sense, a limited relaxation, which will have some impact on the upward pressure on the coronavirus. But the key thing is people have just got to be sensible. And they've got to be really sensible going in, because we want the rates to be as low as possible during and on the way out. Really, really critical.
Thanks very much. Final question, if we can get the tech to work, back to Chris Meyer at the Times.
Thank you. Can you hear me now?
Yes.
Apologies for that before. So firstly, can I ask the CMO just to put this new strain into context for us? You know, how common is it to see mutations like this? You mentioned it had a lot. I gather some are on the spike protein. How much of a concern is that? Or given that viruses tend to become less deadly as they mutate, you know, should we all relax? And to the Secretary of State, I mean, you seem to be suggesting that there aren't any circumstances in which you would reconsider the Christmas relaxation. So when you say people need to take personal responsibility, do you mean by that if we're planning to see elderly relatives, we should essentially be self-isolating from now until then?
I think that if you want to see elderly relatives at Christmas, we all know that the best thing to do is to make sure that you don't have coronavirus, and the best thing you can do if you want to see elderly relatives at Christmas, is to be extremely careful now about who you see. And that's the way to see loved ones in a socially distanced way at Christmas, but do so in a way that is safe. And I'll ask Professor Whitty to answer on the new variant. And if I may, because this is the last question, I also would like Professor Fenton to mention the vaccine rollout across London and also the importance of getting the vaccine for all Londoners.
So I think Professor Fenton should have the last word. So I think that in terms of the background, I mean, I hope what I'm saying won't be really obvious, but this virus, which is going to be with us now for the foreseeable future, will continue to produce mutations over time. Very many of these will just die out. We'll never know about them, they'll just disappear. They won't provide any benefit to the virus. Some of them will be neutral, they may spread, but they don't make any difference one way or the other. A few of them will have new properties. Now, whilst there's no strong pressure from a vaccine, there's no strong pressure from very, very widespread immunity, although there is probably some, it's fairly unlikely that they will be massively advantaged by having an ability to evolve around those variants. You're right that overall the tendency is, if anything, for things to become less virulent rather than more virulent. But that's over a long period of time, and some things can actually become more virulent along the way, so it is possible. The more common things is that obviously there is a fitness advantage, and this is kind of GCSE biology point, fitness advantage to if a particular mutation makes it easier to spread through the human population, that is likely to advantage the virus, that particular strain of the virus, the particular variant, and therefore there is a probability then that it will spread more widely. So the idea that new mutations might become more likely to spread is not particularly surprising, because biologically that's an advantage to the virus, whereas there's no particular advantage to making you more sick than other things, so that there's no evolutionary advantage, so there won't be a strong pressure on that. And in the long run, there may be an issue about new variants evolving that are less affected by natural immunity, less affected by vaccines, and therefore we may have to have vaccines which are done on a regular basis where we take the latest variants and we actually revaccinate over time, just as we do for flu. So that is, in the long run, that's what's likely to happen. But this is just one, albeit significant variant, but there are many others in the system, and there will be many more in the future. This is the natural process of evolution for any infectious disease.
Thank you very much. Does that answer the question, Chris?
Yeah, but I mean, just in terms of vaccine, the spike protein, is there anything to be concerned about? There are mutations there on this particular variant.
Yeah, so there are mutations on the spike, what's called the spike protein. This is loosely what it uses to attach to cells to get into them. And several of the vaccines have got activity, in fact, most of the vaccines have got activity against the spike protein. We don't know whether these variants are going to actually affect that, but there's no evolutionary reason why that would be advantaged. And that's being tested, as I say, in Porton Down at the moment. And we should have answers relatively soon as to whether there's any evidence that what's called neutralizing antibodies, these are the antibodies that stop a virus getting into the cells, are affected by this mutation. If there is, then people will need to go back and think about vaccine formulation. But I don't think there's any reason at this point to think that's particularly likely, but let's wait and see what the science shows us. And I think Professor Fenton, there was a question for him.
So I was going to reflect on the vaccine program and how that's progressing, certainly in London. It is miraculous that just over a year after first discovering and describing this disease, coronavirus and COVID-19, we are at the point of having a highly effective vaccine that can prevent health harms and severe disease, and perhaps bring an end to this year of this pandemic. So now more than ever, it's important for all of us who are eligible for the vaccine and who are prioritized for the vaccine that we take this opportunity up. The NHS in London is doing phenomenal work, working to develop the hospital hubs to begin the delivery of the vaccine to those in greatest need and those who are prioritized. And we're now poised to develop and deliver the vaccine to primary care sites that will encourage and engage more people who are at risk to take up the vaccine. I know that for many Londoners, there's still questions about the vaccine, but it is highly effective, and we're working with our partners in the NHS, with faith organisations, with community organisations across the city to ensure you all have the information that you need to make the choice to take the vaccine, and to encourage family members who may be at risk to take up the vaccine as well. This is going to be one of the keys to unlock the door to the end of this pandemic. And I'd like to encourage all Londoners, and in fact everyone around the country, to take up your opportunity for the vaccine when you're able to.
Thank you very much. That concludes today's coronavirus briefing. Thank you.